Hello, how are you? In today's video, I'm going to talk to you about the symptoms of low blood pressure or arterial hypotension. Some people sometimes feel unwell during the day and don't know if it's a glucose problem or low blood pressure. So you'll love to know exactly what helps you notice that your blood pressure has dropped. What the main causes of low blood pressure are. Stay with me until the end because you're going to love this video. First of all, if you're new here, take this moment to subscribe to the channel and turn on the notification bell. There are new videos here every day and you won't want to miss them. If you know someone who is always feeling unwell and seems to always have low blood pressure, share this video. Let's help as many people as possible because that's truly what I want to do here with this channel. I decided to make this video today because a lot of people get confused when they feel unwell, not knowing if their symptoms are related to low blood pressure or low blood sugar. So I decided to prepare this video about low blood pressure for you, highlighting the main symptoms so you can better understand what they might be. But always remember that to get a diagnosis, or if you need any kind of treatment, you will need to see your doctor. Normally, when a person has good blood pressure, is normotensive, as we call it, their blood pressure is around 120/80, and the cardiovascular system works well, they feel good, everything functions very well. When some people tend to have lower blood pressure, usually below 90/60, some very unpleasant symptoms start to appear, causing a certain discomfort. Blood pressure, in fact, is related to the pumping of blood by the heart and the resistance of the vessels, the arteries and capillaries to this blood flow. I'll refer to all of them as blood vessels here, just to make things easier, but you know that they include all the vessels in the cardiovascular system. If the vessel is too relaxed, if the resistance is very low, when the heart pumps blood, it passes through too easily, and as a result, the blood pressure ends up being lower than normal. Of course, low blood pressure can be caused by other factors, not just this issue of pumping or vessel relaxation. It can be caused by pregnancy. Some pregnant women have somewhat low blood pressure because of the baby's blood flow and their own blood flow, so many pregnant women have low blood pressure. Many people who have suffered some kind of blood loss, an accident, or a major trauma have low blood pressure and can even experience what we call hypovolemic shock, which is when the amount of blood is so low that the blood pressure drops significantly, and it is a very serious health condition. In addition, some people have low blood pressure due to dehydration, sometimes from taking some type of diuretic, some kind of medication, or from being exposed to very high temperatures, sweating a lot, or urinating a lot. They end up becoming dehydrated, which can lower their blood pressure and cause all that discomfort, which I will talk to you about later. There are some people who have what we call orthostatic hypotension, which is when someone was lying down, stands up very quickly, and their blood pressure drops rapidly, causing them to feel all that discomfort. Usually, the symptoms are very similar. The symptoms are not listed from most severe to least severe, but rather in order of how frequently they appear. The first symptom is dizziness. Usually people feel dizzy, unable to stand still in one place. Some even say they see stars, feel somewhat disconnected, or are unable to walk in a straight line. All of this happens because their blood pressure is lower. In addition, fatigue is another frequently reported symptom, mainly because blood circulation is not working as it should, and the supply of oxygen and nutrients is somewhat impaired, so fatigue is also very commonly mentioned. This fatigue occurs in some people, as you may have noticed. Sometimes the person has just woken up, it's still morning and they're already sleeping on the couch, or they get in the car and immediately fall asleep because of the lower blood pressure. And often, it has nothing to do with the level of physical activity. It's not someone who just cleaned the house, went for a run, or hit the gym. The fatigue actually becomes chronic because their blood pressure is always low, so this can also happen to some people who suffer from low blood pressure. Some people have a type of low blood pressure that we call postprandial, which is related to eating. It happens right after you have lunch or dinner. This is especially common in elderly people. And in them, in particular, this fatigue occurs frequently because of low blood pressure after eating. Usually, it could be an uncle of yours, a parent, someone a bit older, who often feels very tired after eating. Sometimes people think it's because they ate too much, but that's not always the case. Their blood pressure actually dropped after the meal, and that's what causes this fatigue. Some people also report feeling very nauseous, experiencing a lot of nausea when their blood pressure drops. So this can even interfere with some people's eating habits. You have to be very careful if the person already tends to feel very nauseous, very sick, and has no appetite, especially if this is happening after meals. As I mentioned before, in some cases, some people suffer from postprandial hypotension, so that's another symptom you should watch out for. There are also people who report that their vision becomes more blurred. and they have more difficulty seeing. Of course, when blood pressure is lower, there's discomfort, dizziness, and nausea, so this also affects vision. You need to be careful in these situations. In extreme cases, some people may even faint or lose consciousness because the change in blood pressure is so drastic. It was normal, then it dropped so much, the difference is so great that the person actually loses consciousness. And this is dangerous, especially if you are out on the street, or if it's an elderly person who is alone at home. So it's really important that we assess whether these symptoms are recurring. If you have a family history or any previous sensitivity, it's a good idea to monitor your blood pressure more regularly, at least once a day, or even more often if necessary, especially if you are going through a more delicate period. If you don't have a blood pressure monitor at home, usually pharmacies can take your blood pressure for you, so that can be an option as well. If you're someone who is more prone to low blood pressure, if, for example, your blood pressure tends to drop when it's very hot and you feel unwell or almost faint, remember that it's not a good idea to go too long without eating. Because the reduction in salt that we normally consume in our diet, even if we don't add extra salt, most foods contain some salt, helps keep your blood pressure a bit higher. So, remember to eat at regular intervals, as this will help you as well. And don't forget to stay hydrated. As I mentioned at the beginning, dehydration is one of the causes of low blood pressure. So, in addition to eating, it's important that you drink plenty of water. It's no use drinking soda, it really has to be water. It's important to develop this habit to prevent yourself from feeling unwell. If you've been feeling unwell, but you're not experiencing exactly the symptoms I mentioned in this video, it could be that your blood pressure isn't low, but actually high. I have a video here on the channel about the symptoms of high blood pressure. It's worth watching so you can make sure whether the symptoms you've been noticing in your daily life are related to low or high blood pressure. And now, tell me down below if you suffer from low blood pressure. What symptoms do you notice in your body when your blood pressure drops? Is there any other symptom you experience that I didn't mention in this video? Let me know down below. If you know someone who suffers from low blood pressure, share this video. Let's grow this network of kindness so I can help as many people as possible. That's what I want to do here with the channel. Like the video now, because that also helps me. And if you're new here, don't waste any more time. Subscribe to the channel now and turn on the notification bell. I have new videos every day covering symptoms of various different health conditions, teas, juices, recipes made by me, and lots of great tips for your health. See you next time. Bye.